Now it's really the practical points from today of putting together the things you've heard, starting with Joe Eichen's talk regarding the hip and the athletes, going through surgery, and Jeff's talk about operative and non-operative management of the elbow. And really, we're going to look at what do we do now? How do we apply that to our athletes, particularly for baseball and softball? But really, you can look at this as applicable to really any overhead athlete to a point. A little bit about my background. I was from originally the state of Minnesota, moved to Nebraska, so I'm a Husker fan by default at this point. I came back to play baseball in college where I pitched and was also a catcher, so everyone's favorite combination that we're all supposed to do and recommend. Thankfully was able to avoid injury. You could probably argue it's because I didn't throw hard enough, but amongst other things, I knew my career lie outside of baseball. In terms of our plan today, we're going to cover a number of different things. We're going to start with just a general review of some of the common musculoskeletal adaptations in the overhead athletes. So what is normal and what is abnormal? And really, it's important for us to all be aware of that, people that are coaching, that are rehabbing, and treating these athletes. We're also going to review just general epidemiology of shoulder and elbow injuries in overhead athletes, looking at risk factors. And then lastly, we're going to dive into some of the actual hard applicable pieces in terms of exercise. We'll have some videos available. And I'm also going to have a model come up here as well. My current student, Brian Galen, who just passed his certified strength and conditioning test yesterday, I demanded that he come down and spend a full day and sit in a room and learn about overhead athletes. So I thank him for being a part of this as well. And disclaimer, he said he is not a baseball or softball player, so don't blame him if he's a little bit stiff or maybe not moving quite the same as some of these athletes would. So what is normal in the overhead athlete? So throwing-induced adaptations occur over time. They begin as we start throwing as young people, and they progress. The longer you throw, the more these adaptations are going to take hold. They can be from a variety of different things. They can be due to osseous adaptation, meaning the actual torsion of the humerus from repetitive overhead motion. There can be just birth and developmental differences in terms of glenoid version, as well as adaptation over time. There's also soft tissue adaptation, so repetitive movement into that abduction externally rotated position will eventually create some laxity in the front of the shoulder. And really what we have to decide is that pathologic or is it not? And if someone is not hurt, I would argue nothing you see as an adaptation is pathologic. So it's that balance between mobility enough to throw a ball overhead, but stability to not be injured in those positions. So if you see someone with excessive external rotation, limited internal rotation, as Jeff referred to earlier, if their total arc of motion is pretty similar side to side, they don't have pain, that's not a bad thing. It allows them to be an elite overhead thrower. Going back to Kim as an example, as a very high-level collegiate softball pitcher, I remember when we first got into this in PT school, she could show us how she could inferiorly sublux her shoulder. You could create a sulcus sign.